quality control management and infection control management, important topics. Okay. Those who are not appearing for the exam, it's okay. Those who are appearing for the exam, kindly keep your books in front of you. Those who have infection control, you can go through the infection control important topics. Those who are having quality management can go through the quality management important topics. So first we'll do quality control management. So when you start your textbook, in the first 20 pages, it's about quality management, cycle of measurement, assessment, improvement. So for the exam point of view, nothing will be there from that. Okay, so if you're studying for the exam, pages 1 to 20, you can just ignore that. Okay. Next, you have to come to page number 20. I don't know in your edition which it is, but evaluating performance. From that chapter, questions will start coming. Page number 20, evaluating performance. Did you all get it? Okay, so yeah, so in evaluating performance, like 3-4 questions can come. You have the different tools, right? Pie chart, pyramid. Just go through that once. And on page number 22, there is this thing, what to say, data, division of data, qualitative data, quantitative data, nominal, ordinal, binary, discrete and continuous data. So at least 3 questions can come from this part. Okay, so focus on this chapter. Then you have your histogram bar graph, just read it once. And your scatter diagram, scatter plot diagram. You can have a question like, which of the following is true about scatter plot diagram? It talks about cause and effect, option A. Option B, it talks about correlation between 2 variables. Option C, it gives an idea about the error. Option D, none of the above. So what is the right answer? Scatter plot, what it does? Correlation. Correct. Thanks, Ashwati. So some questions like that you can expect. So read that all together. Then read the chapter. So this is the type of thing that is going to come from this performance evaluation. Okay. Then you move on to page number 31. In page number 31, you will have models for performance improvement. Okay. In models for performance improvement, PDCA cycle. So read about PDCA cycle, who invented it. It is also called as Deming cycle or Shewhart cycle. What is Kaizen? What is Kaizen Blitz? You can get a question on the full form of PDCA, Plan, Do, Check, Act, Plan, Do, Control, Act, Plan, Do, Copy, Act. So you have to find out the right, right full form. All right. So that is for models of performance. Then at the last part of the chapter, there is 5 why technique. Okay. So you can have a question on what is this 5 why technique, where it's finding the root cause. Again, you will ask why. So if there's a medication error, why there was an error? Because of excessive stress. Why there was stress? No staff in the department. Why no staff in the department? It was raining heavily. Why it was... So you basically 5 why questions. Okay. So 5 why technique, just read it. Then there is, on the next page, page number 32, there is 5S. 5S is sort, straighten, shine, standardize, and sustain. You can expect one question from 5S also. Okay. So read that. And Six Sigma. Six Sigma, what is DMAC methodology? DMAIC. D stands for define, M is measure, analyze, improve, and control. Okay. Now we are moving on to the next chapter, that is medico-legal safeguards for doctors and nurses. Okay, that is page number 34, 35. In medico-legal aspects, just read the chapter once, and for exam point of view, focus on exceptions of informed consent. That is on page number 36 in my textbook. In your book, you check which it is. Different editions are there. Exceptions for informed consent. Go through that. And also that section 33, section 340, section 491. No need to by heart all that. Okay, that is just for your understanding. What you need to learn is the last page on that chapter. That is page number 40 in my book. There are three things you have to read. The mistake of the law, res judicata, and res ipsa loquitur. These three things you have to read because there are three questions from this page. Okay. Mistake of the law means being unaware of the existence of mistaken understanding of a law, including the erroneous conclusion of law, is not excusable. For example, if a doctor carries out a prenatal sex test to abort a female fetus, cannot avoid any prosecution by saying he was unaware of the law which punishes that. Just because he was from US and he says in US this was not a punishable law. In India, I didn't know. So when a doctor practices in another country, obviously he has to take the renewal license of that particular country and he should revise the laws of that particular country. So mistake of the law, res judicata and res ipsa loquitur, these three things you have to read. Okay. Next chapter is WHO guidelines for patient management. In WHO guidelines, nothing much. You can keep away from that chapter. Next important chapter is IPSG goals, International Patient Safety Goals. You need to know all the 6 IPSG goals, okay? And in that, you can have a question like, which of the following is not an IPSG goal? Option A would be identify patient correctly, improve effective communication, ensure safe surgery, readmission to the hospital. Which of the following is not an international patient safety goal? Can you answer me? A, identify patient correctly. B, improve effective communication. 3, safety of high alert. 4, readmission of patients into the hospital. Exactly, readmission. So that's the right answer. Yeah. So you can have a lot of questions. Yeah, you're right. You can have a lot of questions. Which of the following is true about so and so, except. So be attentive. When you get except, that means that is not the answer, this thing. Okay, because people just read first part of the question and just write it. Just get the answer. So don't do like that. Read the international patient safety goals. Okay. Next chapter is spectrum of services. Just read it. Nothing's going to come for the exam. If I say nothing's going to come for the exam, I know you all are going to quit that chapter. But I'm just telling you. Patients' rights and consent. Read the consent, okay? Informed consent. One question short from informed consent. Quality standards for nutrition therapy, just read. Pain management, only read. Quality end of life care, just read. Next, transplant also just read, okay? Next important one for exam point of view is your surgical safety checklist. WHO surgical safety checklist. So read about sign in, before skin incision, time out, and sign out policy. Okay, one question sure shot, 1 or 2 questions from this chapter is there. Okay, surgical safety. Then quality standards for medication management. Medication management, medication error, anyone, they may ask you which of the following is the medication error, that way type. Okay, you don't need to by heart anything. Sentinel events. One question from sentinel event. They may give you 2, 3 options and say which of the following is not a sentinel event or which of the following is a sentinel event. Near miss event also read, okay? Near miss event. Near miss event, applies to more than potential medication errors. Near misses also include other types of adverse reaction. Hospital establishes a definition of a near miss. So read that. That's okay. Then we come to sterilization. वो सब नहीं. Food services. Open to food page services. That's on page number 87. Around 85, 86, 87 food services. So that you read class 1, class 2, class 3 and which class of food items require a food safety officer. Okay. And food safety program. Read that. Class 3 require food safety officer. Okay. Then coming on to facility management, hazardous waste. Just go through that. Okay. Then waste management. Waste management, 1 or 2 questions can come. For your exam, see, all your hospitals will have your own protocols for exam. Just write what is there in the textbook, okay? What is given in whichever color, what is there in your textbook, please write that as the right answer for your exam. Then comes your disaster management program. Usme kuch nahi, no need. Fire safety, no need. Yeah, then you go on to TB infection control, page number 107. The screening questions and all about TB. Just read that, okay? Then your 5 moments of hand hygiene. Little bit of infection control will come in quality. That is in the last part of your book. Okay. Then, yeah, hand hygiene, 5 moments. Then designing different levels of ICU infrastructure and planning. That page number is 128 in my book. ICU infrastructure, ICU planning and designing. Okay. In that, read how level 1, what you require, level 2, what you require, level 3. No need to buy hard, just know what it is. Level 1 will be a basic this. Level 3 will be a higher, larger hospital scale. In that, don't read the whole thing. Recommendations are there on page number 139. Recommendations for level 3 ICU, level 2 ICU. Read that. Level 3, level 2, 1 or 2 questions can come. Okay. How many beds, how many equipments. That's it. So that was there. Then staff addition. I think that's enough for quality. So quality, basically, you're going to have only 25 questions, 100 marks. Each question for 4 marks, if it is 25 questions. And yeah, that's it. You will have your link sent to you on September 1st or 2nd. No need to ask people. Your mentors will send you the message, okay? Either on 1st or 2nd or 3rd, you will get the exam link. Exact date is still not released. That's why, okay? So you don't have to appear on the same day. In the next 4-5 days, you can appear any one day. And only during the working hours, you should be messaging your mentors. In the night at 9 o'clock time, 10 o'clock, don't trouble them. You have to message them only 9 to 5. Okay. And make sure you get all your links. If you are getting only one exam, but you want to appear all the exams, don't appear for the exam, complete it on 5 days. And then on the 5th day, ask, I wanted to appear for quality, but I didn't receive the link. Nobody will give you the link. You have to mention on day 1 itself that you want all the 3 links. Okay. Some of you may not get the link. So inform your mentors. They will put a request and you will get the link. Okay. What was it? For quality, you will have only 25 questions. For quality management exam, only 25 questions. For infection control and Six Sigma, you get 50 questions. Hospital administration, 50 questions. Okay. So that is for your topics in quality management. So now I already explained to you. I'll just send you a message also of the important topics so that then nobody has any doubt. What I told you just now, that is the key to your success for exam. Okay. So make sure you study all those things for quality. Okay. Now I'll just message the important things. Emergency and trauma 50 questions. If one person is writing 3 exam, all links can come together or provide in separate dates. All links should come on the same day. You can appear on 3 different days. Okay. All exam links have to come together. So suppose you have decided that you want to appear for quality infection and Six Sigma in September itself. You don't want to keep it for February. Okay. So what you're supposed to do, and you have got only 2 links. Okay. If you have got only 2 links, what you should do, inform your mentor, I would like to appear for all 3 exams, but I have received only 2. So your mentor will put a request and you will get that link also. Then depending on your convenience, you can appear whenever you want to. Okay. What was the other question? For critical care, only 25 questions. And for oncology, you will have 50 questions. They are very easy papers. Is it clear? Everybody is clear about quality management? Any doubts? Now we move on to infection control. Yeah, did you all get the important topics? Everybody just copy it. I've just messaged it. But more than the message, what I spoke is more important. I've exactly told you what all to focus on. Itna you'll do, all of you will get above 80, 100%. Now open your infection control textbook. Those of you who are appearing for infection control exam. Okay. In infection control, see the first chapter talks about the infection control team and all. Nothing is going to come for the exam. Then surveillance of healthcare associated infections, nothing will come for exam. So you can skip that. I think now people will say, how many marks will be the exam? Exam is 50 questions, 100 marks. Yeah, okay, I'll do it on hospital administration also. Himani just dropped. Himani, I've already sent you what is there for administration. Don't worry. Hospital administration is 50 questions, 100 marks. Okay. Then, yeah, standard precautions, page number 14. Consider all patients potentially infectious, all blood and body fluids, all and sterile needles. One question for sure from that. So read the standard precautions, that page. Then 5 moments hand hygiene. Sarita, in OT management, there is nothing much. It's more of infection control. Na? Second part is OT subjects. So the first part is infection control. Read that well. And OT ka first 20 pages. That's it. And you will be able to clear the exam. So 5 moments of hand hygiene. Then your duration of hand hygiene, 20 to 30 seconds, 40 to 60 seconds are procedure for visibly soiled. That you have to read, okay? Because you will have questions. Then, personal protective equipment, cap, mask, and gown. 1 or 2 questions will come on order of putting PP, removal, cap, mask, and also your shoe cover. Okay, so read that. Then boots and shoe cover is on page number 43. Mask is page number 45 and 95 and 100. Just read that. Okay. Then blood and blood sample, nothing will come for the exam. So don't worry about that. Then isolation, airborne transmissions, read that. MRSA, VRE, vancomycin resistant enterococcus. Visitor policy, read visitor policy, page in book. Visitor policy. One MCQ can come from visitor policy. Okay. Then WAP attaches um, the organisms, for them it's a protection. So the wound is always going to be infected. So you have to deep clean that. So you have to remove that biofilm so that your wound gets cleansed properly. Okay. So that there's a question on biofilm from for your exam. So that's there. Surgical site. Yeah. Then again, in infection control, there is surgical safety checklist. So obviously you have to read that, sign in, sign out, and time in and time out. Before skin incision, read that. WAP is given on page number 74. Read that properly. And COTI also read, catheter associated urinary tract infection. Environmental management, not much will come, but page number 81. Full form of HEPA, everybody learn. Later on, don't tell me, oh, I forgot the full form. High efficiency particulate air filtration system. You can get a question which is a full form of HEPA, and everybody thinks they know. Option A might be high efficiency particulate matter. Option B may be high efficiency particulate air matter. So you really get confused. So learn the full form. AIIR room, airborne infection isolation rooms, air ventilation. This lighting and all you don't need to read. Noise control in ICU. Okay, read that. One question can come. Then cleaning, sterilization and disinfection. Um, don't study and by heart what is autoclave, how much degree, all that is not required. Okay. Just know the levels of disinfection, high level, intermediate and low level disinfection. You should know what is that. Okay. That's it. Then how, page number 99, disinfectants and how sodium hypochlorite 1%. How do you use it? Yeah. How do you clean your BP cuff pressure? See, open to page number 102 and 103. What is there in that columns? Study that. They can ask, how do you dispose of the syringes or needles? Or how do you disinfect a cuff of BP apparatus or a oral thermometer or a rectal thermometer? So that 2-3 pages are there, which shows about how to clean and disinfect. Page number 102, 103, 104 and 105. Read that. Okay. 2-3 questions can come from that. Then, okay. Spalding classification. Which page number is it? Fumigation fogging ka page number 111. Have you got that? Spalding classification. One question will come from Spalding classification. The classification of risk of transmission of infection by instruments and equipments has been called as Spalding classification. So read that, okay? Critical, semi-critical and non-critical. Did you all get it? Spalding classification. Then nothing is there. Housekeeping and all, you don't need anything. Theater. Spillage. Mercury spillage. Read that. Biomedical waste. I already spoke to you. Even in quality, it will come here also. So just read what is there in your textbook. And on page number 145, that hazardous waste symbols are there. Cytotoxic symbol, biohazard, radioactive material. So learn that symbol, because any one symbol will come. Which of the following is the right representation of this symbol? Okay, they can either ask you cytotoxic ka symbol, biohazard, or radioactive material. Then CSSD, nothing much. No need to learn anything from that CSSD, CHIV and all. After page number 156, there is very less. Nothing will be asked. Needle stick injury, read. Needle stick injury. Needle stick injury, one question. Then nothing is there. Once, always, you must read the glossary. Any exam glossary you must read. This is it for infection control. I'm sending you the important topics on the chat. You all can copy it from there. Okay, everybody got? Now I've completed quality also and infection control important topics. Did you all get it? Yeah. So in infection control, you will have 50 questions and 100 marks. And in quality, 25 questions, 100 marks. There's no negative marking, so you can appear. And make sure that you all don't make any mistake in writing your email ID name. There are people who have written wrong names, and then when that certificate comes, we will not be able to change. Please be very careful when you write your name and email ID, because whatever email ID you type, in that your result is mailed. If you put a mistake, like, some people, for example, dinnydavid@gmail.com, my D is capital, I've typed. But actual email ID, it is case sensitive. All are small letters. Sometimes after dot, the space is put. So at least be mature enough to type your email ID, your name correctly, so that you will not have any issues. Okay. And make your address. Whatever address you want your certificate on, that address should be mentioned in your exam correctly, with the correct pin code, name of the floor, building, everything, so that it's not misplaced. Then the exam is very easy. I don't think so anybody fails. Just read the book at least 2 times, and whatever I've told you, that is enough. That important topics. Okay. Tomorrow, as usual, your sessions will be there. Any other doubts you all are having for quality and infection? Any other doubts for quality and infection? For critical care, study AV blocks, uh, adenosine injection, read about MI, stroke, and VTAC, VFib, asystole, SVT, PEA, ventricular tachycardia. Okay, that's it. Next is what? Question. Emergency and trauma management is all practical. In that textbook, you have the dialogue boxes, right? That square boxes, what is there in the textbook. From those story questions will come, majority of your questions. So read those diagrammatic forms better. Hospital administration, I have a list. 1 second, I'll give you. Six Sigma, yes, take. I'll just brief the Six Sigma also, since many people are there for Six Sigma. I've sent the Six Sigma important topics. So open your books to Six Sigma. Open your Six Sigma books. Nursing leadership is a mixture of quality, infection, and all. Whatever topics I told in quality, infection, that topic in nursing leadership, that textbook will come for the exam. Okay. So, and nursing leadership focus on pages 1 to 50. Just read that 2 times, that's sufficient, and focus on the quality and infection control topics of nursing leadership book. So, Six Sigma, those who have taken Six Sigma, you open to page number 3. The first page, Lean plus Six Sigma is Lean Sigma. So, which of the following is true about Lean Sigma? Option A, reduces waste, reduce defect, accelerates Six Sigma, all of the above. What is the right answer? All of the above. Okay. So, that type of question can come. Then, what are the benefits of Six Sigma? Okay. What is the value of, correct, all of the above. What is the value of Six Sigma? 3.4 DPMO. Full form of DPMO, defects per million opportunity, can come for the exam. And this number 3.4. So it can come, what is DPMO full form? Or what level is Six Sigma? 3.4, 3.2, 2.3. So the right answer is 3.4 defects per million opportunities. That. Then benefits of using Lean Six Sigma. Read that. Then, page number 15. Six Sigma training levels. Okay, yellow belt, green belt, black belt, and master black belt. How many? So in yellow belt, your revenue increases $10,000. Green belt, $50,000. Black belt, $1 lakh and above, and more than that. So this will come for the exam. Level Six Sigma training levels. Okay. Uske baad, no need to read the next few pages. Next is in Six Sigma, remember very well, you have to read the glossary at least 5 times. Many questions will come from the glossary itself. So read the glossary 5 to 6 times. Okay, hardly 4-5 pages are there. Read that properly. You can appear for the exam. Then common terminologies in Six Sigma. Pareto diagram, process mapping, root cause, control chart. Read that. Okay. Pareto diagram is a 80-20 rule. One question sure shot it is there. Then there is no calculations or sums that are going to come for Six Sigma. 50 questions. Six Sigma methodology. DMAC, DMADV full form. Define, measure, analyze, improve, control, and methodology DFSS, designed for Six Sigma. All these full forms also learn. Methodologies learn. Then SIPOC, page number 38. SIPOC. S stands for supplier, I stands for input, P stands for process, O output, and C is customer. So that also learn the full forms and what is there in each. Okay, SIPOC process. Then move to page number 41, where you have the Six Sigma level. 6 Sigma, 5 Sigma, 4 Sigma, 3 Sigma, 2 Sigma, and 1 Sigma. How many defects per million opportunity? So 1 sigma can come for the exam or 6 sigma can come for the exam. Look at the numbers properly and write the right number in the exam. Select the right number. You don't have to write it because you have it. Then page number 42, failure mode and effect analysis, FMEA, or mistake proofing. One question will come from that. So read that 2 to 3 times. Failure mode and effect analysis, FMEA. Then models for process improvement, Kaizen or Schubert cycle, Deming cycle, PDCA model. This is the repetition in quality. One question will come from that. Who invented or what is the full form of PDCA? Then 5S model, sort, straighten, shine, and standardize will come. Then qualitative and quantitative data, nominal, ordinal, binary data, page number 65. That will come for the exam, 1 or 2 things. So study all that, nominal, ordinal, and data. Affinity diagram, one question, 100%. Affinity diagram, Pareto chart. So read about affinity diagram, Pareto chart. Then fishbone diagram. What is a fishbone for? Cause effect. Root causation is a cause effect diagram. So that one question is there. Which of the following is true about a fishbone diagram? Scatter plot diagram. That also one question will come. Whichever I'm telling, that will come for sure. Then yeah, that's it. And then you read your mean median mode. Mean median mode, read mean median mode. Page number 94 in my book. With sampling methods, page number 93 and 94. Probability or random sampling and non-probability or non-random sampling and mean median mode. Okay. Bell curve. So that 3 pages and then your glossary. That's all for 6 Sigma. 6 Sigma is also very easy. 50 questions, 100 marks. Okay. Yeah. Now I have sent the important topics of quality, infection, and 6 Sigma. I spoke about the critical care. Critical care girls don't get so much worried. It's easy paper. Anything else you all want to ask? So that's it. Don't wait for the last day to finish your exam. Whenever you get the link in 1 to 2 days, try to finish it. Last day, if some technical issue, you're not able to log in or something, try to finish whenever you have time. Okay? Hospital administration, I send you important topics. Didn't I send? Oh yeah, I'll send. 1 second. Huh? Kajal wants it, na? Wait. I'll send. Yeah, I've sent you hospital administration. Quality, I already sent, Rekha. Quality, I have sent the first. Again, I'm sending quality, those who didn't get. Okay. Now everybody is tension free, I think. All right. Okay. So then have a happy weekend. You all take care. Bye bye. See you next week. Bye, everyone.